Morning, everyone. Welcome to Bank Holiday Monday, May the 3rd. Can't believe it's May already. Good morning, Simon. Good morning. Yeah, hopefully we should have a few online today, unless you're sleeping in. You can still watch on your phone. So, yeah, we're going to do a whole session today on the heart. So, we're obviously moved up the body now into the thorax. We've had a look at the ribs, rib cage, the muscles of the ribs. We then started to look at the lungs and the relationship between the lungs and the ribs and the diaphragm. Yeah, I thought I'd spend a bit of time just going into the heart in a bit of detail because most of us on here are either therapists or fitness professionals. So you would have done some kind of study on the cardiovascular system. And probably know the basics around the heart. So we're just going to go into that in a bit more detail. And I know we've got quite a few people as well that have signed up for the cadaver workshop, and which is brilliant. Be good to see put some faces to the names that pop up on the screen. But you'll get to see some hearts. Okay, so the stuff that we see today, you'll see those, and you'll also see some medical interventions as well. So there are some hearts in the lab that have got valve replacements, so you can see what that looks like. So there's some really cool stuff that you'll be able to see. So let's get going. Let's get rid of that sec. Here we go. Okay, so first thing, I'm just going to do like a top line view of the heart and kind of really simplified. Morning, Stevie. How you doing, mate? Happy bank holiday. Yeah, so we're just going to do a kind of top line view of the heart and basic structures. So when I used to teach level 2 gym instructor courses and level 3 sports massage kind of stuff, and this is how I used to teach the heart. And it's basically as a box. And that's where we're going to start today, and then we're going to build on that. I did do a little video on this a little while ago, so that there is one on Learn Anatomy Online. Hey, Penny's visible. Hi, Penny. Good to see you this morning. Okay, so what we're going to do, we're going to have a look at the main structure. So, and we're going to follow the blood flow through the body. So we've had a look at the lower extremity so far on all of the sessions that we've done, and we've seen some vessels that go from the legs and then up through the abdominal area and then piercing through the diaphragm. So we saw that over the last few weeks, and one of the things that we saw was the vena cava. Now, the vena cava are the main veins going back to the heart, so deoxygenated blood going back to the heart. Where they arrive is in the right atrium. Okay, so they come into the kind of top left quadrant of the heart. Although I do it like a box and it's simplified, it's not actually like that, and you'll see that as we go through. And then just grab my arrow. So as it comes up from the vena cava, you've got two vena cava. You've got an inferior one and a superior one. So the inferior vena cava from the lower part of the body, that's the bit that we've seen already. So coming up through the abdomen, and the veins have got valves in. So and the blood is transported through movement. So by muscles squeezing things and you moving around, moving organs, it pushes the blood up through the veins, and then the veins with their valves, as the blood goes up, the valves open to let the blood go through, and then as the blood drops back again, the valves close, so then they stay in that portion. Okay, so that's most of you should know that, but if you don't, then that's what veins do. And then we've got a superior vena cava coming from the head, and we haven't covered that yet, but we will do as we go up into the head and the neck and into the arms. We'll have a look at the blood supply from that region as well. So it comes into the right atrium, and the atria is like a hallway. It's like an entranceway. So the atria in the heart receive blood. Okay, and the vessels that come into the atria are called veins. Okay, so the veins come into the atria, and then there is a valve in between these two. Morning, Julie. Morning, morning. We've got all the regular faces there. Good. So in between the right atrium and this box down here, which is, I'll just get that up there. That's the right ventricle. Okay. There is a valve in between here. Okay. So we've got valves here, and then valves here as they're coming in as well. So basically, everything is geared up to prevent backflow. Obviously, there are pathologies where backflow does occur, but the body is designed to prevent it. So deoxygenated blood through the veins into this entrance chamber, the atrium, and then they go through the valves into the ventricles here. And then the ventricles, the ones on the bottom, so this one here and then this one here, which we'll come to in a sec, these are the pumping chambers. So the walls of these chambers are a lot bigger than the atria, because the atria, all they have to do is pump the blood from here into here. So it doesn't have to go very far. But the ventricles, this right ventricle has to pump the blood to the lungs, and then the left ventricle around the body. Okay, so they need to be thicker, they need to be stronger, so that they can eject the blood out of the heart and into the relevant areas. So obviously the right ventricle hasn't got far to pump the blood, because it's got to go into the lungs. So the walls of the right ventricle are a lot thinner than the ones on the left side. And again, this is just a top level explanation, and we'll go into this in a bit more detail in a second. Whenever you think of the blood supply into and out of the heart, veins are always come in, okay, and the arteries always go away. Okay, so if you remember arteries away, we years ago, before I kind of understood this in any amount of detail, we always used to say that arteries had oxygenated blood and veins have deoxygenated blood, but that's not entirely true, because of what we're going to have a look at in a sec. So remember, this is deoxygenated blood from the body coming into the entrance chamber of the heart. It goes through this valve in between the two here into this right ventricle, and then arteries away. So we've got an artery going away, which is that one. Okay. Anything with the word pulmonary or pulmonary, however you want to pronounce it, is to do with the lungs. So the right ventricle pumps the blood to the lungs. Okay, and there's a pulmonary artery to the left and to the right, obviously going to each lung. So this has got deoxygenated blood in. So this artery doesn't carry oxygenated blood, it's deoxygenated blood. So we've got deoxygenated blood coming in through the veins, right atrium, right ventricle, and then that right ventricle is then pumping that deoxygenated blood to the lungs to go and pick up some oxygen. Okay, and then coming back into the heart. So on this side, we've got a vein coming back in. Okay, and these pulmonary veins, so pulmonary again is coming from the lungs, and these contain oxygenated blood. Okay, so this is why the arteries away is a better way to remember the flow of blood through the heart. Okay, and not arteries have got oxygenated and veins have got deoxygenated. Morning, Neil. No worries. No problem. You're excused on a bank holiday Monday. Don't worry. Cool. So we've got pulmonary veins coming into. Let's get the right button into the left atrium. Okay, so this is the left entrance hall. This side of the heart deals with oxygenated blood. This side of the heart deals with deoxygenated blood. Okay, so again, apologies if you've covered this kind of stuff before and you know it already, but I'm going to go through the basics and then we'll add on the layers. So this blood coming into here has just come from the lungs. Okay, so it's freshly oxygenated into that left atrium, and then it goes into, get that back, it goes into the left ventricle. So this is the main pumping chamber. Really good. That's nice. Always remembered it as vein as in and arteries out. Yeah, so that's nice with the I and N on the vein as an in. That's good. Cool. I like that. So we've got the vein, the left ventricle here, which is the main pumping chamber of your heart, and then the blood vessel that comes out of that is your aorta, which is the main vessel coming out of the heart. Okay, so that, like I said, that's how I used to teach it on level 2, level 3. Used to teach it as a box, and then I'd get people with a card written up on there, like a piece of paper, saying I'm a right ventricle, I'm a left ventricle, and then we would get some oxygen and some blood linking up with each other, and they would walk through the system so that they could see the blood flow through the system. And I used to use the students for that. Some of them liked it. Teaching 16 to 18-year-olds how the heart works was tough work. Cool. So we're going to have a look now at that in a bit more detail. So this is, just get rid of that. Here we go. Cool. So this is kind of where we were at last week. So we were having a look at the lungs. We were having a look at the relationship between the lungs and the heart. So that this is where we are now. So obviously the lungs were there. They've now been taken away, and rather than being a square, you can see the heart. It isn't kind of heart shaped like Valentine's Day. It's kind of oblong, and it's it kind of the apex sits up a little bit, so it's not directly down. It's kind of on its side, and you'll see the relationship in a second. So if we have a look at some of these vessels here, that is your aorta. Okay, so that huge vessel there, that's your aorta. And so if we think about what we've just seen, so if we go back to here, so that's that there. Okay, coming out of the left ventricle. So it's a massive, massive vessel. Just play that again. Okay, huge vessel coming out there. So that is your descending aorta going down there, and we've got an ascending aorta up there. You've got your diaphragm down here. These are all the vessels that we're going to have a look at over the course of this session. And then we've got the it's on a loop. Let me just get rid of that loop. And I'll just go all the way to that last one. So that bit there, just on the side there, there's your vena cava. Okay, so that would be your superior vena cava coming down into that right atrium of the heart there. So that vessel there is your aorta. Yeah, so there's like there's an arch of the aorta as it comes up and then down, and then follows the follows the line of the spine. It then pierces through the diaphragm to go into the abdominal region, and then it will split into your iliac arteries, which is what we've seen previously. Okay, so that's kind of where we were at from the last session, I think. And then this is the heart in a bit more detail. So these are your ventricles, the kind of pumping chambers at the bottom, but see, they're not like up and down, they're along from each other, and then the atria are at the top. So all this yellow stuff here, this is fat. It's quite normal to have fat around your heart. Obviously, excessive amounts can be damaging. And these are the muscular layers of the ventricles. You can see that there's these kind of divides in between the two. So if I just pause that there, so this will be your atria, okay, and they're your ventricles there, and you can see these little pathways that are in between the atrium and the ventricles. So we've got atrioventricular regions. Okay, so and there are valves in between each of those. So the in between the atrium and the ventricles, we have atrioventricular valves, and these grooves, these little sulcus around those regions there, they carry specific arteries, which we'll have a look at as we go through. So we'll kind of build it up as we go. Okay, so ventricles at the bottom, here and here, and then atria at the top. So that's your left ventricle, and then the right ventricle around here, and then this is your right atrium. So if I just pause that there, so if we have a look at that, so that's the right atrium just there. And if we go back to the PowerPoint, so right atrium just here, okay? And remember, coming into the atria were the vena cava, okay? So those were your main blood vessels carrying deoxygenated blood back into the heart. So if we just go back to that video again, just get to that bit. So right ventricle there, and then right atria just up here. Just keep spinning that around and then hold that there. So if you can see that vessel there and that opening there, that's the opening for your inferior vena cava going into the right atrium, and that's from the superior vena cava coming into the right atrium. So those vessels there will be carrying deoxygenated blood into the heart, ready to then pass into the right ventricle. Okay, and again, if you're learning this stuff anew from scratch and never really looked at it before, in the heart, you have to imagine that the heart is in you. Okay, so the right side is on the left as you look at it on the picture, but if that heart was in your chest, then it would be on your right hand side. Okay, so that's why it's the other way around. Okay, let's have a look at this. Yeah, so and then if I just pause that there, and then this is your left atrium just here. Okay, so you see these openings, these vessels here, all of these. So we've got 4 altogether. So we've got 2 going to the right, 2 going to the left. So if I just go back to the PowerPoint there, so we're going, this is left atrium this time, and those openings are the pulmonary veins, or the pulmonary veins. Okay, so those are oxygenated blood coming back from the lungs into that left atrium. So if I just go there again, there we go. Okay, so left atrium, and then these are the pulmonary veins coming back into the heart. Okay, so that through these vessels here, that one, and that one, you will have freshly oxygenated blood coming from the lungs into that left atrium. Okay, so that's it all there. And there's your right atrium there, which we just had a look at. And then we've got these little kind of, yeah, so there's your vena cava, and then the inferior vena cava coming up from there as well. Okay, good. Cool. So that's kind of basics around the heart. So we're going to have a look at the where the inferior vena cava comes up from in the body. So when it's all together. Let's just get rid of that one. Just pause that back there. Okay, cool. So here's your heart. There's the aorta. That's the superior vena cava coming there. This is your diaphragm just here. So what they're going to do is just pull the diaphragm away a little bit so you can see underneath it. And this is where your inferior vena cava will come from. So just there, and you can see it coming through, piercing through the diaphragm and then coming up into that chamber there. Okay, so that's your right atrium just there. So superior vena cava, inferior, right atrium just there, and then that's where it comes up. Okay, so that's where we are in the real body. Okay, so then we're going to have a look. We're going to follow the pathway of blood now. So we're going to go deoxygenated blood into that right atrium, and then have a look at the structure of the right atrium first. So if we have a look at this side here, so there's your left atrium. Let me just pause that there actually. So that little opening there, opening for the coronary sinus. So see there's a little vessel there, and it goes into the right atrium. So you've got your superior vena cava, inferior vena cava, and then there's this other little opening going into that right atrium as well. And we know the right side deals with deoxygenated blood. So this is coming inferior vena cava from your legs and your abdomen. superior coming from your head and your arms, and then you think, well, where the heck is that coming from? And that vein there that drains into that right atrium is coming from the heart itself. So obviously the heart needs its own blood supply. It needs to supply itself. And you might have heard of the coronary arteries, and they're the arteries for the heart itself. And that coronary sinus is the veins bringing the deoxygenated blood from the heart circulation back into the heart to get reoxygenated. So the heart feeds itself first. Okay, so it's which it has to. Yeah, it makes sense to do that. So that little opening there is where the venal blood, so the deoxygenated blood from the heart itself, gets drained back into the right atrium to then go and get new oxygen. Okay, and we'll have a look at where it where the oxygenated blood comes in as we go through. So another little opening there, and we're going to have a look at this right atrium in a bit more detail. So this auricle here, so anything that's auricle or auricular means it's shaped like an ear. Okay, and this, it looks a bit like an ear. It's a very thin flap, and what it is, it's designed. It's there to increase the capacity of the right atrium. So it's a really thin flap, so it doesn't take up much space. But what it can do is it can increase the capacity of that right atrium. So that's what these auricles or atrial appendages do. Okay, so they're little flaps that help increase the room. So right atrium here, right ventricle just here. So this is deoxygenated blood, okay, and it passes through here. So we're going to have a look at this right atrium in a bit more detail. This is when it starts to get pretty cool, when you can see inside inside the heart. Yeah, so you've got these lines here. So we've got interatrial septum. Now a septum, we did this ages ago when we were looking at the foot and the ankle. So a septum is like a hedge. That's where it comes from. It's a dividing wall between two structures. So obviously this one is interatrial. So there's your left atrium, there's your right atrium, and there is a wall that separates the two. Okay. When you're developing in the womb, there is a hole there, and oxygenated, deoxygenated blood will get mixed up, and then as you develop, that then starts to close, and then you get a septum in between the two. So then you have a clear difference between oxygenated side and deoxygenated side. Sometimes, obviously, there can be defects there. So you might have heard of the term hole in the heart, and that's one of the areas where you can have a hole in the heart, where then the deoxygenated and oxygenated blood can start to mix. So interatrial septum. So we've got this divide here in between the two atria. So deoxygenated on this side, oxygenated on this side. So they're going to create a bit of a window now, so you can have a look inside the atria. Here we go. So that opening there is the opening from your superior vena cava. So the blood from your head and your arms, deoxygenated, will come down from there. And then that, which you can't see very well there, but that's your opening for your inferior vena cava. So just down there. Okay, so that's where your blood will come up from your legs. Okay, and that's your coronary sinus, and then that area there is the interatrial septum. Okay, and we've got something called the fossa ovale, and that fossa ovale is where in the embryo there is a hole there called the fossa, the foramen ovale. So it's a hole between the two, and then it kind of seals itself as you develop, so that it blocks the oxygenated from the deoxygenated side. So it's around that area there. So that bit there is quite thin compared to the rest of the heart wall. So then the blood will travel through there, and there's the valve from the atrium into the ventricle. Okay, and we're going to have a look at that in a bit more detail. So this is now going into the right ventricle. Okay, so if we take this is obviously taken away a bit of the heart wall, and we're going to focus on this this area here. So the atria has been removed, and that's where the atria will be, and this is where the valves are. Okay, that is the line of muscle in the heart. So you can see the thickness of the muscle here, and then that's the pathway of the blood going up. And remember, arteries away, so that's a pulmonary artery. And that is your tricuspid valve. So tricuspid means three cusps, and cusps are like flaps, and they're like triangular flaps that when they come together, they close up, and I mean this is just amazing. You'll see it in a second. It's just amazing when where they close up. So we've got these different flaps just here. These are all the these are the valves. And then there's one that you can't quite see just down here. And then if you have a look, you've got, these are your heartstrings. Okay, chordae tendineae, or how else are they pronounced? Somebody pronounces them differently as well. I've always called them chordae tendineae, and they're basically tendinous cords. Okay, you can see the little like the heartstrings, yeah, attaching onto the cusps, and then these bits here, and here, these are muscles, papillary muscles, and they attach onto the ventricles. So what they do is they act like a brake on the cusps. So as the atria beat and squish the heart through that valve, so through here, so the atria will be here and it will come this way. The valve opens, and then as the ventricles pump and push the blood out of the pulmonary artery towards the lungs, if it pushed and the valves didn't close, then the blood would just go back into the atrium. So the cusps close up, so then the blood is then diverted up into the pulmonary artery, and what those papillary muscles do in the chordae tendineae is they stop the cusps from going back on themselves. Okay, so they act like brakes. So they then seal the ventricle so that it can then be pushed out. And you'll see a little video of that in a sec. So yeah, chordae tendineae there, and then these are the papillary muscles here, and they attach onto the ventricles. And you can see the kind of irregularity of the muscles on the wall, and that's to increase the volume of the heart so it can take on as much blood as possible. Got all these little folds. So the blood kind of comes, here we go. So that's when the cusps close up, and that's when they're open. So that's the kind of thing that will happen when your heart is beating. So the blood will go through, and then as the ventricle beats and it pushes the heart away, pushes the blood away, then the cusps will close, and those papillary muscles will stop them from kind of going in on themselves. Another kind of folds of muscle all around this ventricle wall, so all around here, and then it gets pushed up in that direction there. So you'll see in a sec. So all of those folds help to increase the volume of the right atrium, and then of the right ventricle, sorry. And then as that right ventricle contracts and pushes the blood out, you see this bit here, which is the pulmonary artery, is really smooth. Okay, so we've got that ventricle walls which are full of folds to get as much blood in as possible, and then as it contracts, it then gets pushed up this bit, which is smooth as anything. So then it increases the efficiency of that pump, so to get the blood out and then to the heart. So if you have a look at this bit, look how smooth that is there, and then that is going to the lungs, the infundibulum. There's a good word for you. Scrabble. Okay, and then you can see the valves up there as well, and we'll have a look at those in a sec. Okay, so that's the pathway. So it goes right atrium through those valves into the right ventricle, pump up through into the lungs to go and get some oxygen. Okay, right, let's have a look. Just make sure I get the right ones next. Okay, so it's now got oxygenated blood, so it's gone to the lungs, got the oxygenated blood. We're now coming back, and we're going to go into the left atrium. Here we go. So these are the pulmonary veins. These have come straight from your lungs, oxygenated blood into the left atrium just here. Okay, so these are the veins coming in there. Atria is your entrance hall, so coming in there. We've got another auricle, so we've got this another ear flap to help to increase the volume of that atria as well. And then that's the direction of blood flow down there. There's your valve. That's where the location of the valve is. So we're going to have a look at this. We're focusing on this area here. So we're going to take away that, and then you can have a look on the inside of the left atrium. So there's the interatrial septum. Okay, so that's what divided the right and the left side. So we saw that before. And then we've got this valve through here. And what you'll notice with this one is there's only two cusps. So this is called sometimes called the bicuspid valve. The other one was the tricuspid. Sometimes it's called the mitral valve as well. Okay, so it depends which textbooks you read. Okay, so let's have a look at this one. Just get rid of those. So then that goes into your left ventricle, and here we go. So this is the main pumping chamber for your heart. So if I just pause that there. So the left atria was here. That was the valve that we just had a look at. So that was the bicuspid or mitral valve. These are the chordae tendineae. So these are your heartstrings of that side. And on the right ventricle, because it was tricuspid, there were three papillary muscles because there were muscles attached onto each of the flaps of the valve. On this side, there's only two, okay, because it only needs two. So you'll see that. But have a look at this. Look at the thickness of that wall compared to the other side. Yeah, so that this chamber does the maximum amount of pumping. So it needs to be really, really thick, and it kind of the blood kind of goes back on itself as well. So it comes through here and then up through there. And then these are the differences between the two walls. So if I just pause that there. So this is the interventricular septum, so in between the ventricles. This is the right side, and it's like a C shape, and you can see that the muscular walls are quite thin. Okay, this is the left side, more like a circle, and you can see the thickness of the muscles on this side compared to here. Yeah, so the right ventricle has only got a pump to the lungs, it hasn't got far to go. This left ventricle has to pump to the whole body, so it requires a lot more mechanical effort. So you can see the development of this. And then these are the papillary muscles just here. So you can see them, the ends cut just there. And like I said, these are the kind of things that you'll be able to see when we go to the lab. So there's your valve, there's your mitral valve. Excuse me. There we go. So those are your papillary muscles. There's the mitral valve. So the left atrium will be on the top of this, going through. And those are the cusps of the valve. And if we have a look at from the other side, so there's your chordae tendineae again. So those are your heartstrings. Papillary muscles just there. And then those are the other papillary muscles just there. So you've got one attached onto one cusp and one attached onto the other. And there they are there. So this is looking from the inside now up towards the underside of the valve. And there they are in real life. Okay, so there's the papillary muscle there. There's your heartstrings, and these are the valves. These are the cusps. And you see that one up there as well? That's your aortic valve. And you can see that there's just a slight delay. So it's a fill, push, fill, push. Yeah, you look at the thickness of these walls here, and that's the outflow. So there's the aortic opening just there. Okay. Absolutely fascinating, all this stuff. Well, I hope you find it fascinating too. So then we're going into the pulmonary arteries and the aorta. So these are the main vessels with oxygenated blood. So if we just orientate yourselves here, so this is your left side, this is your right side. So that's the aorta. So that's your main blood vessel coming out of the heart. And that's your pulmonary artery, so the one going towards the lungs. Okay, and you can see these flaps in here. So in the aortic valve and the pulmonary artery valve, there are 3 cusps on each of them, but there are no muscles. They act kind of like veins. Yeah. So as the blood is pushed through, they open, and then to prevent backflow, they just close in on each other. So then the blood can't re-enter the heart again. Okay. So pulmonary valve just there, and then can you see these pouches as well? These are aortic sinuses. So again, there's trying to maximize the space available in these vessels, so they can carry as much blood as possible. Okay, so there's your aorta. I'm going to have a look at the size of the valves in a sec. So there you go. You can see they're kind of like, it's like half a parachute. That's how they're described. Okay. So they're quite flexible. And there they are flapping there. Look. Okay, so water, fluid going through, and then drops the pressure, and then they close up again. And they're really quite flexible. Such good pictures there. Really, really cool. Okay, so we're going to have a look in a second. So there's your aorta. There's your pulmonary valve or pulmonary trunk. So go into your lungs. And one of the first things, so that's going towards your lungs just there. And there's your aorta just there. So they sit quite close to each other. Left pulmonary artery going to the left lung. Right pulmonary artery going to the right lung. These are your pulmonary veins. Left atrium, aorta, vena cava from the superior. Okay, so the network of vessels is just insane. That ligamentum arteriosum just there, that in the embryo is a join between the aorta and the pulmonary artery, but it stops joining basically once you're fully developed. Cool. So the last thing to cover is the fact that the aorta has 2 little blood vessels coming off of it. They are quite variable, like everywhere else in the body, but they obviously got freshly oxygenated blood straight from the lungs. Okay, so the pulmonary veins have carried that oxygenated blood into the left atrium. It's gone down into the left ventricle. The left ventricle has pumped it through the aorta, and in the aorta, as soon as it comes out of the heart, you've got 2 vessels, and they're called the coronary vessels. So the coronary arteries are the first places that the heart feeds. And the first places it feeds is itself. Okay, so freshly oxygenated blood straight from the lungs. The first opening out of the aorta is the coronary artery. So it's feeding the heart muscle itself. So this vessel, and remember we saw those little sulcuses in between the atrium and the ventricle. That's what goes in between those, so that it's filled with these vessels. So these vessels will come all the way underneath the heart and then supply the ventricles as well. Okay, so we've got interventricular artery, so in between the ventricles, and then this is the left coronary artery. And the one of the main vessels, if you've done cardiac rehab kind of stuff, is, it will come up in a second. So circumflex branch goes underneath, and then this main one here, you might have heard it as something else. So left interventricular artery. This is often called your left anterior descending, or LAD. And when you, if you do cardiac rehab stuff, then you'll be familiar with that artery. So if you, again, look, so straight away off that aorta, it's feeding itself, and the branch is going everywhere, especially on this left side, feeding that left ventricle. Yeah, because obviously that's going to be blood hungry, that area of the heart. And then obviously these are variable, and it feeds everywhere. You can see them all coming off here, look. And all down there. So that there's quite a lot of variability in it. You'll see different shapes of the arteries depending on where it is in the body, or which body it is rather. And then the last thing to finish off on is putting it all together. So this is where we were last week, and we had a look at the lungs. We had a look at the visceral and parietal pleura around the lungs and how they kind of adhere to each other as you're breathing. We looked at something called the mediastinum, okay, and this is part of the mediastinum here. So this projection here, and you'll see it in a second, it attaches to the underside of your sternum, of your breastbone, okay, so it'll sit on the back of that. So your heart is located in here, and it's located in a sac called the pericardial sac, and we did have a look at that briefly over the last couple of weeks. So the heart is protected in this sac, and it can also move around in it as well. Okay, so which it needs to, because it needs to be able to expand and then contract. So if we have a look here, we've got the diaphragm. These are the ribs here and here. It's actually 8th rib down here. This is where the sternum would be, down the center. There's your diaphragm. The lungs are obviously deflated, but if they were full of air, then they'd be coming out all the way around here. And then there's the heart there. So sitting right on top of the diaphragm. And then this is the mediastinum just here. So that flap will attach to the undersurface of your sternum. Right. So they've taken some of that pleura away. So this is the pericardial sac that you're left with. And then they're going to, so there's your aorta. And there's your superior vena cava just there. And that's where the valve would be. So they're going to take away this bit, and then there's your heart. Okay, so this is all pericardial sac. There's your diaphragm just there. So the heart sits right on top of the diaphragm. And you can see it's quite loose, yeah? But then around here, you can see where the vessels come through to attach in there. Okay, so all that's pericardium. So if you move that there, there's your inferior vena cava. And then if we move here, you can see there are your pulmonary veins coming from the lungs. Yeah, look how it kind of feeds through. And there's a pulmonary artery going towards the lungs just there. And you can't see it very well on this left side, but you can see it on the, well, the left-hand side as you if it in situ. Okay, but on this side, so the right-hand side of the heart, you can't see it very well. Okay, cool. And there's your heart. Okay, it's a bit it's a bit heavy. Yeah, it's kind of easier just looking at let's just go back a bit. It's kind of easier just looking at it like that. I just get rid of some of these a sec. Get rid of those. Ooh. Okay, I'm just going to show you a nice easy slide just to get your head around stuff. Not those ones. Yeah, I think this is important to remember as well. So we've got 3 different circulatory systems going on with the heart. So you've got the pulmonary circuit, which is to do with the lungs, and we've had a look at that. We've got the coronary circuit, which is the heart supplying itself. And then we've got the systemic circuit, which is going to the body. So obviously we've looked at this all in detail now. The red side is oxygenated, so aorta coming out to the body, so that's systemic. And then coming back from the lungs, so this bit here, and going out to the lungs, that circuit there is the pulmonary circuit. Okay, so that pulmonary arteries going away into the lungs, getting oxygen, and then pulmonary veins back into that left atrium. Okay, so yeah, pulmonary circuit there, and then systemic circuit there, and then there's the coronary circuit, which isn't on here, which feeds the heart itself. So we've got 3 circulatory systems. Okay, I just want to go to one particular bit. I'm just going. Here we go. Cool. So if that was a bit kind of like blow your head off because you never really looked at the circulatory system before, this might help. Okay, so this is the flow of everything through the heart, and quite often you need to know this for exams. So right atrium through the tricuspid valve, which is what we've just seen, into the right ventricle, and then the right ventricle into the pulmonary semilunar valves, pulmonary artery to the lungs, pulmonary veins into the left atrium, and then left atrium through the bicuspid valve to the left ventricle, and then left ventricle through the aortic valve, semilunar valve, into the aorta, and then from the aorta into the systemic circulation. Okay, so that is the pathway of blood through the whole, all of the heart. Okay, so that's why that's why I used to teach. Just go back, teach it like this because it is a lot simpler to understand. And you can kind of label the square with all of the valves and where they are and where they go through, and it's a lot easier to get your head around to learn it like this. But then, as you've seen in real life, it's a little bit more complicated than just a square. So you can see where things are going through and where everything attaches. I don't blame you, Simon. Yeah, you can watch it back at your leisure. No problem. So yeah, hopefully you enjoyed that one. Yeah, I hadn't really planned to cover things like the heart, but as we got up to that area, I thought we need to go into it really. It's pretty important, isn't it? So if on the next session, we're going to have a look at the nerve supply around the thorax, and we'll probably start to go up into the neck because there won't be much left to do for the thorax now. Okay, cool. I hope you enjoy your bank holiday Monday, what's left of it, and I will see you again next week. Cheers, guys.